Hello, everyone. A very warm and heartfelt good afternoon to everyone. I am anchor Monica Tiwari Mishra from Radiance with You YouTube channel. I'm sure you all must be keeping good health. Today, we are diving into a topic that touches everyone under the sun, literally. We embark on a crucial discussion as we raise awareness about fungal infection and the proactive measures we can take to prevent their spread. Fungal infections might not always be top of mind when we think about healthcare, but they are certainly not to be underestimated. From athlete's foot to nail fungus to many more serious conditions like invasive candidiasis, these infections can wreak havoc on our health and well being if left unchecked. But fear not. We are not just here to talk about the problem, we are here to discuss solutions. From simple prevention techniques to the latest advancements in treatments, we'll be diving deep into strategies for combating fungal infections and safeguarding our health as this is a fungal awareness month. That's why we are thrilled to have Dr. Jalpa Kapadia from Mumbai with us today. Dr. Jalpa Kapadia, a distinguished dermatologist, cosmetologist, and trichologist, renowned for her expertise and compassionate care. As the founder and director of Devasya Skincare and Polyclinic Mumbai, she leads with a commitment to excellence and patients' well-being. With an impressive academic background, Dr. Jalpa completed her MBBS, DDV, DDVL. Along with the surgeries, you do laser facials and Hollywood peels too. Dr. Jalpa's professional ethos revolves around providing the same level of care she would want for her own family. She understands the profound impact skin condition can have on mental health and self-confidence, thus ensuring her patients receiving comprehensive and holistic treatment plans tailored to their needs. Expert in her field, Dr. Jalpa Kapadia has successfully completed various dermatosurgical procedures like chemical peels, microdermabrasions, derma roller, derma pen, mesotherapy, Botox, fillers, electrocautery, radiofrequency, CO2 laser for various skin lesions, vitiligo surgeries, laser hair reductions, and many more. Thank you so much, doctor, for joining us today.
Thank you, everyone. At the outset, I would like to thank the Hetero Healthcare team for inviting me to be part of this great initiative of the Fungus Health Awareness Month. And also, I would like to thank the associates of Radiance with You channel for giving me this opportunity to share my experience with everyone. Thank you so much. A very good afternoon to all of you. And
Thank you
let's
so much, ma'am, for joining. And we have many questions to ask, and we have some viewers also who are waiting to ask some questions from you. So, my first question to you is what are the most common types of fungal infections that people should be aware of?
So let's understand one thing that what is fungal infection? It's actually an infection which is caused by yeast or by molds. It can affect any part of the body, whether it can be skin, it can be internal organs also. But for today's discussion, we'll keep it pertaining to fungal infections of the skin. Now, depending upon the kind of fungal species, we can have various kind of fungal infections. Commonly, we see the yeast infections which are caused by Candida. We also see pityriasis, versicolor infections which are caused by Malassezia, and the most common ones are the ringworm infections or the dermatophytosis infections which are seen. Now, this depending upon the area which is involved has names like jock itch, which is where the fungal infection, when it is seen in the inner sides of the thighs, we see it as jock itch. We also see it as athlete's foot, where we see fungus causing irritation and maceration of skin between the west spaces of the toes. We also see when we see it in the beard areas, we call it as tinea barbae. It can virtually affect any area. If it affects the nails, we see yellowish and whitish discoloration of the nails. Sometimes it even causes disruption of the nail as well. When it's seen on the other body part, it's also called as ringworm because it tends to kind of clear in the center but spreads in the periphery, so it virtually looks like a ring. So that's so these are the most common kind of fungal infection that we see in our practice.
Yes,
Rarely we also
ringworm is very common. Usually, whenever you people see ringworm, they are very much familiar about it. But other infections, they are not aware of this. They don't treat also. And some people thinks that these fungal infections are on the joints only. So please tell us about that also.
yes, so fungal infections may start commonly on the joints because fungus per se loves moisture. So
Mm-hmm.
anywhere where the moisture, where the sweat retention is there, that's a place where the fungal infection may start. But virtually it can affect any part of the body. So we have seen patients where fungal infection can be in the hair, fungal infection can be even in the private parts. It can affect on the any part of the body, with the hands, legs. But yes, the folds are the places where it starts initially for most of the patients because that's where the moisture is trapped more.
Yes, correct. Please also tell us how do fungal infections typically spread and what are some common risk factors associated with them?
So fungus is the main risk factor behind fungal infection is low immune system. That is where fungus is tend to spread more in those with low immunity. However, it is not that normal healthy individuals cannot have fungal infection. In a city like Mumbai, where the humidity is very high and we tend to
Mm-hmm.
sweat a lot, and especially for those who are wearing, say, you have gymmers or who are athletes wearing tight synthetic clothes, the sweat
Yes.
retention is more, the moisture retention is more. These are the people who commonly come to us with fungal infections. Those with athlete's foot are commonly office going individuals, who are wearing shoes and socks all the time. So where the sweat is getting an opportunity to stay for such long hours that they literally come with
Mm-hmm.
peeling of skin between the toes, and sometimes they have unbearable itching once the socks are removed. So virtually
Mm-hmm.
any population is affected, but yes, those with low immunity, especially those with diabetics or those with a little substandard levels of hygiene, are the ones which are commonly coming with fungal infections.
Yes, means sweat is the major reason behind the
Moisture
fungal
retention.
infection.
Yes, yes, yes.
Yes, yes, yes. Okay, so are there specific populations that are more susceptible to the fungal infection? And if, please tell us why.
So, as I mentioned, the low economic sector of the society, commonly we see fungal infections in that group. Sometimes it is probably because that they are limited access to hygienic measures. We come across a lot of individuals who don't have
Mm-hmm.
a bathroom of their own. So they're sharing a public bathroom where
Yes.
they may not be able to clean themselves properly. Sometimes after interviewing a lot of patients, we do understand that they are unable to remove all their clothes and take a proper bath. So, where that's a situation where we have individuals wearing their inner wear even while taking a bath. So, the sweat, the water retention is always there. Then they are unable to clean themselves
Mm-hmm.
properly, dry themselves properly before wearing clothes because of the time constraints and water constraints. So this is the strata of society which commonly comes with very, very extensive fungal infections. We also see it a
Yes.
lot amongst those who tend to sweat a lot. For example, cooks, as servants who are doing a lot of physical activity. We have daily
Sports
wagers who have
players.
a lot of
Yes.
fungal infections. And nowadays, unfortunately, even athletes who are training for long hours, because of the sweat retention.
Mm-hmm. Yes. One more thing I would like to ask that you are telling that people using common washrooms may be affected by this fungal infection, but some sprays are also coming in the market, like safe sprays, which we can spray and we can sit safely. So, are they safe? We should use them or not?
No, so when I say about using common washrooms, I also would, there is as I said, okay, it's a very practical thing, but there is a section of the society who takes bath in a common bathroom outside. And when we've interviewed a group of 100, 200 patients, we came to know that most men would not remove their innerwear before taking a bath. So imagine wearing
Mm-hmm.
those wet clothes, imagine not cleaning themselves completely, especially over their private parts. So these may be very small matters but very very practical in the long run, because when you are looking for cleanliness and better hygiene, you need to make them understand that all these factors are equally important. And so now that the government is improving, and the number of common bathrooms and toilets available, but this further needs more improvement, and that education to the patients is also of paramount importance. Talking about the sprays, the toilet sprays, and yes, they are important in their own way because they help us to prevent other kind of infections also. But I believe that public education to the public about general hygiene is equally important here, which cannot be
Yes, so
emphasized.
true. So true, ma'am. That's why we are celebrating this fungal infection month so that we can educate people so that they can maintain hygiene and can be prevented. So, my next question to you is about prevention only. What are some effective prevention methods individuals can take to reduce their risk of developing fungal infections?
So that's very important, and I'm happy that you asked because this is the most important thing. Of course, when you come to a doctor, they are going to give you medicines, but the do's and don'ts are very important. So A is one needs to keep the so whenever to prevent fungal infection, I would say try to wear loose cotton clothes whenever possible. Synthetic
Mm-hmm.
clothes, tight fitting jeans, and semi-synthetic clothes, they don't let the skin breathe well. Try to, especially in a humid city like Mumbai, or even if in a summer month, try to wear loose cotton or linen clothes or any natural fiber that allows your skin to breathe. Keep wiping the sweat at frequent intervals whenever possible. Third is one should trim their body hair and private part hair every 8 to 10 days or at regular intervals. So because again the hair can trap moisture and aid the fungal infection. Then
Mm-hmm.
there is also an important thing about washing clothes. It's all nowadays with the coming of washing machines. There is a practice in a lot of households to dump the clothes directly into the machine. So it's always a good idea to soak the clothes for at least half an hour in hot water before they are hand washed or machine washed. This soaking of clothes in hot water will help to kill the fungus. Thirdly, one must ensure the clothes are properly dried. It's a good idea to turn the clothes
Mm-hmm.
inside out and ensure that the seams and all dry out before washing them. If possible, one may also iron the clothes, which is a good idea, especially once the rains start, because then we want the clothes to be dried. Sometimes uh, later on, once the rains start, the clothes don't dry completely. So one should ensure that they wear dry clothes. If the clothes are wet or moist because of whatever reason, one should change clothes frequently. That is what we advise to our gym goers or to our athlete patients also.
Mm-hmm.
That don't stay in those clothes for long. Once you're done with your physical activity, please change your clothes, take a bath, or even better, take a bath at the earliest possible time. For office goers, we do suggest them that if they have a desk, if they can, remove their socks and, kind of air dry their feet in between if possible. Or they can have slippers in the office if they can wear at their desk level and change into shoes
Mm-hmm.
if that's a possible thing. Though it might not be possible all the times, but these are things which can be looked upon for prevention.
Yes. Yes, yes, very important things you have told us. Ma'am, please tell one more thing. Do we need to put any solution? I will not take any brand name. So please tell us, you have said that we have to put our clothes into a tub in a
No, no,
hot
I'm just saying
water
hot
before
water.
storing.
You may not put some washing detergent, but at least in hot water or about around 40 degrees. Your geyser hot water is good enough. Whatever bath that you can take in that water is even better. That you can soak the clothes so that it can kill the fungus.
Okay. Ma'am, many viewers are joining us. So a question is there. I would like to ask.
Yes, please.
Kirti Kapoor is asking, are there any lifestyle changes I can make to reduce my risk of fungal infection?
Yeah, Kirti, that's a good question. I would say apart from the do's and don'ts that I told you about the loose cotton clothes, I would say that especially for our patients who are on the higher side of weight, the overweight patients, they tend to sweat more compared to their normal counterparts. So we ask patient to do some physical activity, lose weight, because then
Mm-hmm.
the sweat retention is less, and so that there are lesser folds. Try to encourage patients to lose weight, so this helps them to reduce the sweat and overall improve their immunity, their stamina also, so the fungal infections is less. And I would also say that for patients who are often wearing shoes and socks, we do tell them that they can dust some nowadays you have clotrimazole powder, you have medicated ketoconazole powders, terbinafine containing powders. They have some role that they can trap the sweat and reduce the chance of recurrence once that or prevent fungal infections in the long run.
Okay. Thank you, ma'am, and thank you so much, Kirti, for asking this question. Another viewer, Rahul, is there, and he is asking, are there any specific lifestyle changes or dietary habits that patients can adopt to strengthen their immune system and reduce their susceptibility of fungal infection?
So generally, as I said, fungal infections can occur in any individual. But if a person is getting fungal infections again and again, we look into their sugars, we look into their vitamin D, we look into their iron stores. So apart from weight loss, we check patients' vitamin D levels, their thyroid levels. Anywhere where there is a weakened immunity, we try to correct it. Their iron levels. So first we check them for low, whether they are low in hemoglobin or low in the iron stores, and if that is less, we try to improve it. We take a detailed history, and if they are low, if they are faltering at any level, we try to rectify it by giving them appropriate medicines. And
Okay.
also there is a tendency that too heavy hot and spicy food tends to increase sweating.
Yes,
Alcohol
nowadays,
smoking
yes.
also increases more of sweating, so we encourage patients to quit and smoking as much as possible.
Yes, ma'am. You have already told to reduce the weight for the fat patients, but one more thing I would like to ask you, please tell us in brief that are there certain environments or activities that increase the livelihood of contracting a fungal infection?
I would say anywhere where a person is working in an environment where they tend to sweat more is going to increase their chances. But at the same time, what if one tends to maintain proper level of hygiene, one's chance of acquiring infection is low. So whenever possible, try to wipe the sweat at frequent intervals, wear loose cotton clothes. Another thing is when you know that you're going to be out for longer time in a hot weather, it's a good idea to dust some antifungal powder for some prevention on the folds, like on the underarms, inner sides of thighs. Then before wearing the jeans, before wearing the pants or something, they can just dust some around their thighs. So this will help them to at least reduce the chance of acquiring fungal infections. And I would
Yes,
also
yes, they
like to
have.
try to cut down hot, spicy food, have more water, so improve their hydration levels. This will work on the long run.
Yes, to improve your hydration level is a very good advice from Dr. Jalpa. Ma'am, you were telling about some practices also to use dust powder and all. So, can you please tell us the importance of maintaining proper hygiene practices in preventing fungal infections?
So as I mentioned before, that any kind of fungus would thrive more on the moisture if it has to work for a longer time. So if you ensure that you keep the skin dry, especially
Mm-hmm.
those these affected areas dry, the fungus may not be able to thrive for long because fungus needs moisture to thrive on. So
Yes.
wiping the sweat at frequent intervals, even after taking a proper bath, we come across a lot of individuals, especially women who are into a hurry. They will wear all the clothes in the bathroom. They're not dried themselves completely. So we educate women to and encourage them to spend a little few more minutes for themselves, dry themselves completely before wearing the clothes. Also ensure that you're wearing clean and properly washed and dried clothes. So these small things may go in the long run to prevent fungal infections.
Yes, of course.
And
People
also,
knows sometime, but they do not
if I
follow
can just
this. So
add,
you have to follow. Yes,
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 if I can just add that for our patients who
yes.
are coming with a lot of fungal infections on the nails also. So especially
Mm-hmm.
housewives, so we tell them that once when you wash, see housewives or those who are cooking frequently, their hands tend to remain wet for a long time. So we tell that while
Mm-hmm.
washing your hands frequently and drying them, later on you ensure that you dry your nails also, because
Mm-hmm.
otherwise the nails tend
Yes.
to remain moist for a long time. The nail folds and the cuticles, they tend to remain moist, and that is where the fungus also tends to come.
Yes, of course. Ma'am, Chandramani, our viewer, is there, and she is asking that in our country, India, many home remedies are also there. So, do we should use these home remedies, or we should go to a doctor only?
Well, I would say that coconut oil does have some antifungal activity, but when you have an established infection, it is a good idea to meet your nearby dermatologist and get yourself treated, because there itself a simple coconut oil may not be enough to treat you. So it is
Yes.
always better to get yourself examined. Again, in dermatology, a lot of things may look similar. So unless and until
Mm-hmm.
you're very sure that what you have is a fungal infection, not otherwise, it's always better to get yourself examined properly by a nearby dermatologist, confirm the diagnosis, and take treatment. And here, I would like to stress that it is necessary to follow the doctor's advice and take the and even if your infection is taken care of, continue the medicines till the time the doctor advises you, because there is something called as clinical cure, and a doctor would might want to give you medicine for 2 3 weeks even after your
Mm-hmm.
infection has seemingly subsided, so as to prevent recurrence.
Yes. Yes, so we should go to our dermatologist so that we can get the treatment so that we can be prevented. So, moving to our next question, Raju is there, a Raju. He is asking how can patients with weakened immune system protect themselves from opportunities fungal infection and what prevention measures are recommended for them?
So Raju, I would just say two things, that when you know that you have a weakened immune system, you need to really step up your hygiene quotient. So that's follow all the measures that I mentioned. Secondly, your doctor will also give you something to improve your immunity and ensure you that you take those along with your if there are any other medical ailments that you have, you take the medicines. Try, if suppose if a person has got diabetes and their immune system is low, one needs to try to get the sugars in control by taking proper medicines, adhering to dietary measures which have been told, and at the same time take some immunity boosters also to step up their immunity. And again, I can't stress enough the importance of the hygiene factor, that keeping themselves clean, wearing loose cotton clothes, wiping the sweat at frequent interval, trimming their body hair. So all this helps in a long run. Getting themselves periodically tested, that is where see, all patients with fungal infection may not require repeated blood investigations and everything, but when we have a person with opportunistic infection, they need to do their bloods frequently, and they need to show that to their doctor also. They need to tell them what all medicines they are in, because some antifungals may have some interaction with the medicines that they're already taking. So here they
Mm-hmm.
those with opportunistic infections, they should never self medicate, never share their medicines with anyone, and ensure that they meet their doctor and take medicines accordingly and for the required amount of time.
Yeah, sure. So we should never self-medicate ourselves. We should go to our dermatologist and take the medicines which are recommended for you. Are there any dietary or lifestyle changes that can help boost the body's immune system to better fight for fungal infections? Because diet is a very important factor in our lives. You
So
have already told about the junk food and alcohol, but I would like to you to briefly explain this.
anything which increases heat in the body and increases sweating, that's something one needs to reduce. So hot spicy food, one needs to
Mm-hmm.
reduce. Take more water, try to eat more of fresh fruits. uh,
Mm-hmm.
One a good thing that in the diet is try to eat something low iron, low vitamin D. In fact, issues may also trigger or cause more persistence of fungal infections. So it's always better to eat some greens in the include greens in the diet. Try to eat a high protein source like millets, or have something like say dairy in their diet, so their protein intake is taken care of. Exercise is always important, but at the same time, dry yourself, clean yourself after exercise is equally important. What I mentioned before. Third, always try and go lower on the masalas. You want to eat more natural foods as much as possible than the over processed food.
Bilkul. So exercise is very important for us, but the most important thing after exercise is to dry yourself completely. Note down this tip and do follow this. So continuing with this, my next question to you is what role do antifungal medication plays in both preventing and treating fungal infections?
So, as far as treatment of fungal infections go, uh, alone sometimes screens may not be enough. So we need to give them oral medicines along with creams. One general for in most of the fungal infections, the dose of the medicines will depend upon the kind of fungal infections. And as doctors, we would like to see for say for example, if a patient is having ringworm infection, we would like to treat them for at least about 4 to 6 weeks, and then see them
Mm-hmm.
again and examine them and plan if additional medicines need to be given. Of course, along with the topical and oral medicine, some patients may require additional medicines to reduce the itching also. Once the infection is taken care of completely, and the patient has no symptoms, no itching, no red, scaly rashes, nothing, or a doctor may continue a topical antifungal cream for some time because they want to ensure that even whatever is not visible to the naked eye is also taken care of. So sometimes your doctor may
Mm-hmm.
give you antifungal cream for 3 to 4 weeks, even after the fungal infection is completely gone, so as to ensure that there is no residual fungus left. There are nowadays a lot of antifungal powders also available. They may play an important role in prevention by by not allowing the sweat to retain and helping you to keep the areas dry.
Yes, ma'am. So please keep this thing in mind that after your fungus is treated, your infected area is treated, then also if the doctor is giving you any cream or something, so you should apply this. You should not think that the treatment has been done, why we should use this cream. So such thoughts should not come in your mind. Ma'am, one more thing I would like to ask that please tell us, uh, does fungal infection spread
Yes,
from
it
one
can.
person to another?
Nowadays, thankfully, most of our patients are not sharing their towels, napkins with
Mm-hmm.
others. But back in the day, we do come across a lot of individuals, especially from the little poorer section of the society, where they are shared that the same towel is shared among multiple members of the family.
Yes, yes.
So that may cause the infection to spread. Using children staying in hostel, sharing their clothes may
Mm-hmm.
also cause infections to spread. And
Mm-hmm.
untreated fungal infection has more chances in spreading. Once you're treating yourself, the chance of spreading really reduces.
Mm, thank you, ma'am, for the answer. And Harshita Gupta is here, and she is asking, what steps should I take to prevent spreading fungal infection to others, especially in shared living or working environments? That's what about we were discussing about.
So in the working environment, if you what I would say is ensure that A is your room where you are working is adequately ventilated. There is a good movement of air. Second, wear loose cotton clothes wherever possible instead of wearing, especially I see a lot of workwear nowadays where there are synthetic materials being used. So we do advise that it's always better to stick with natural fibers, especially if there is a uniform anywhere that can be used, because that will allow the air, the skin to breathe. Third is while using washroom facilities, it's always better to for ladies that you can dry the toilet seat properly after using basic tissue and hand sanitizer. Dry the skin, dry the toilet seat
Mhm.
properly, and uh, even after cleaning, it's always better to wipe the seat dry for others. It's a social commitment that it's not towards ourselves, it's also towards others. Ensure that you dry
Yes.
yourself after using the washroom so that the chances of water retention and sweat retention is less, right? And stay hydrated at all
Okay.
times.
Yes, yes, this is the most important tip Dr. Jalpa is giving all of us, that we should be hydrated every time. So, ma'am, one more thing I would like to ask, that there are any stages in this treatment, that sometimes say the fungal infection is of first level or second level, or we can treat it very easily, or it is difficult to treat. Are there any kind of stages also in this?
Well, not I would not say stages, but it depends upon the how much is the extent of fungal infection. Some patients may just come with one or two flaky patches. Some may have an extensive body involved. So your person needs to be educated that the treatment is going to take some time, and many times, unfortunately, patients may feel shy of coming to the doctor, and they may end up taking medicines from pharmacy where sometimes they are given antifungal and steroid combination creams. Now this is a subset of people who comes with a lot of redness. They come with a lot of thinning of skin. Sometimes they come with stretch marks. They come with untoward side effects of those wrong creams. So your I would really with your channel I would like to emphasize people, please stop using creams, OTC creams directly from the pharmacy, especially uh, combination creams containing steroids are completely not allowed in for fungal infections. One should stay away from creams, especially containing clobetasol or mometasone containing antifungal creams, because these steroids within the antifungal cream formulation will weaken the skin, and they may cause stretch marks, and they may actually cause the fungus to penetrate much deeper than the skin. And patients using steroid containing creams may feel that once the cream is removed, their fungus again comes up. So they keep on applying the cream.
Yes.
Their skin gets
Uh-huh.
addicted to such cream. Such patients may come with thinning of skin, lightening of skin, sometimes whitening, even developing bad stretch marks. So please don't self-medicate. Fungal infections need to be treated by a proper doctor. So please visit your
So we
nearby
are
physician, preferably a dermatologist, and get yourself treated. I would also
Yes, so
add
we
up
are
at
please keep this thing in mind. A very important tip Dr. Jalpa is giving us that please don't get self-medicated. Please take a proper prescription from a doctor, then only take the medicines, whether they are medicines to take upon or any tube or anything. Please, yes, doctor, you can continue with
I would
saying
just like to
something.
add up one thing that many patients feel their rash on their private parts is always fungal
Yes.
infections, but it is not that. Sometimes the rash may be caused by some kind of skin allergy, some other
Hmm.
skin condition. So we do also, it's like a very vis-a-vis situation. We also come across patients who have been taking antifungals and topical antifungals for 3 4 months, and then we examine them. We realize they don't have a fungal infection; they have something else. So
Hmm.
please ensure that your doctor has examined you, checked you, and then take the medicines. If you feel that
Yes, of course.
nowadays you have a lot of female and male dermatologists, if a person is feeling shy to show the doctor, you can always meet, like for a female patient can meet a female doctor, a male patient can meet a male doctor and get yourself examined. Please, a doctor doesn't feel shy in seeing you, and you should also not feel shy in meeting your doctor.
Yes, because sometimes when the allergy or the fungal infection or just any allergy is also there, people shy to meet doctor if their allergy is in their private parts.
Correct,
So,
but the
what would
medicines
you
are
like to
completely
say?
different. For an allergy, the medicine is different. For the infection, the medicine is
Yes,
different. So they need to be seen.
yes, correct. So, please go to the doctor, treat yourself, take the prescription, take the medicine which is recommended by the doctor. Don't go to pharmacy or take the medicines. So we'll continue with this session. And the another question I would like to ask you is that are there any misconception or myths surrounding fungal infections that you would like to address?
So there are some people who, uh, in my experience, have come across a lot of individuals who have tried, local preparations. Somebody has tried Jakmeru, somebody have tried some OTC creams, from Jandu
Mhm.
balm to Vicks and everything. But it is not that fungal infections need proper treatment, and it is not that fungal infection will never go. Once treated, if you follow proper precautions, which I told, fungal infection chances of recurrence are much reduced. So there is a myth that fungal infections tend to always be there and always come again and again. No, it's not true. You can get yourself completely treated, and if you follow the precautions properly, recurrence will not happen again soon. Or even if it recurs, it will not be that bad. And later on, probably recurrence will go off completely.
Yes, ma'am, in rainy season, this fungal infection grows more. Would you like to suggest
Moisture.
something for rainy season people should take care of?
Yes. So, see, in rainy
Yes, ma'am.
season, what you're
Continue.
also worried is moisture. In summer, it is a sweat. In rainy season, it is
Yes.
the water and the moisture. So, these are two seasons
Water.
where one needs to
Yes.
be on high alert. Rainy season,
Mhm.
there's one big challenge is with the clothes don't dry. The clothes which are washed and they don't
Mhm.
dry. So if you have a dryer facility at home, one should make use of that For those who are drying clothes in the open, I would say dry clothes under the fan, and dry clothes in such a way that turn them inside out and dry them so that the seams are dried. If possible, iron the clothes straight and on the reverse so that you ensure that you're wearing clean and completely dry clothes. Change your clothes as soon as you come back if your clothes are wet. Don't stay in those wet clothes for long. For office goers, we have
Mm-hmm.
this facility in our clinic where we have kept a set of extra clothes for our employees in rainy season. So it's always better if they can change
Yes.
into drier, cleaner clothes if their clothes are soaked in the rains.
Mm-hmm.
So
Yes, ma'am.
these are the do's and
So,
don'ts.
at last, would you like to say something? Any message or any tips would you like to give to our viewers?
So I would just like to emphasize over here that uh, the entire IADVL team is trying hard to fight against steroid abuse in fungal infections. So with folded hands, I would like to request
Mm-hmm.
everyone that please avoid steroid-containing antifungal creams. If you're using any creams, please ensure that you are using the correct cream by getting them checked by your general practitioner or your nearby dermatologist. Don't self medicate. Take the medicines for the time that the doctor has told you. Even after the infection is gone, please follow the precautions, the preventions that we told you. The hygienic
Yes.
measures need to be continued even after your infection is settled so that you don't get a
Mm-hmm.
recurrence again.
Mm-hmm.
That is
You
what I
have
would like
got
to
me. Yes,
say.
these are very important tips which you have given to us and our viewers. Thank you so much, Dr. Jalpa Kapadia, for your valuable time. It has been very informative session for our viewers and for me too. I have learned a lot from you today. It's a great to hear you, ma'am, and we are looking forward for many such sessions for our viewers in coming time.
Thanks again for the opportunity, and thank you to the Hetero Healthcare team for having me associated here. Thank you so much.
Thank you, ma'am, and thank you so much, viewers, for participating in today's session and stay connected to our channel. Do not forget to subscribe our channel Radiance with You. Thank you so much. Issued in public interest by Marcus of Lulibor Lotion Advanced, Genex, a division of Hetero Healthcare. Thank you so much. See you again. Bye bye.
Thank